I was assigned the really sexy topic of infection control and hand washing. Thanks, or as I like to dub it, wash your damn hands. So this is actually, I first started this like, how am I going to talk about this for a half hour? And then it's a surprisingly deep topic. So let's get in there. This was a quote that was actually given to me when I was shadowing somebody back in college. And it really got burned in my mind because the next thing he told me was how terrible it was to put people on methadone for opiate control. And the next person we rounded on an inpatient service was actually a distant family member of mine who said, "Hi, Daniel." And I said, "Oh, hi." So this really got burned into my brain of, the mark of a great doctor is always wash your hands, okay? So if you're not washing your hands before and after every patient encounter, you're awful and you need to repent for your sins, okay? This is really, really important. And if you really did nothing other than take this as the message from this, it will be a success, okay? So how many people die each year because of largely our inability to wash our damn hands? Let's hear some guesses. Every year in the U.S., a specific number, tens of thousands, not specific. Come on. 63,000. I like the admirably focused number. Let's talk about it. So 1.7 million cases a year of people that get healthcare-associated infections. Ask how many die. 10% of inpatients will get infected by us because we put them in the hospital. Think about this every time you do a soft admit. There's a 1 in 10 chance I'm going to infect this person because of my inability to discharge them home. And this costs us $20 billion a year. That is a staggering money. It's over $60 a person per year. That's crazy. So this is Sanford Stadium. 92,794 people can fit into that stadium, okay? It's really bad when you mention a football stadium during a lecture because it almost always means they're all about to die. So 99,000 people a year die because of healthcare-associated infections. I'm really glad it didn't quite make it to 100,000 because that's 1,000 people, but it would make the statistic look more impressive. So think of that. Every year, we're killing Sanford Stadium plus some of the surrounding tailgating in the parking lot every year. And those are Georgia fans, so I care about them. If it was Florida, we'd be like, yeah, healthcare-associated infections. So next question, foam or wash, which is better? We hear some like soft pedaling. It's foam. None of that pedaling, it's foam. It's better, okay? It's more effective. It actually seems to be reducing the amount of colonies you get afterwards. It's faster. It takes you a little bit less long to do because if you're truly washing your hands, it's going to take you 30 seconds, okay? And part of that 30 seconds is really unsmooth because your back is probably not focused on your patient while you're doing it and delays getting started, okay? And it also increases compliance. So again and again, study after study show that people are more likely to do it, and it seems to actually decrease infections more than places that rely just on hand washing. Now, when are some times that you might actually consider washing? If you're grossly contaminated, right? So you've actually got like gunk on your hands and not just my hands look clean, but I just need to wash them off to get microscopic bacteria and viruses off. If they're grossly contaminated, alcohol foam can't actually sterilize your hands, okay? So if you just did an abscess or whatever and you chose to do it barehanded without gloves, first off, gross. But if there's something actually on your hands caked on like that, you need to get it off, okay? So maybe you just did a splint and you've got a bunch of splint material on your hands. Wash your hands because the foam can't penetrate through all that. If you're worried about C. diff, remember the alcohol foam can't kill C. diff spores. Believe it or not, C. diff is probably not quite as much of a healthcare-associated infection as you might think because a lot of people already come in with it as opposed to it truly being transmitted. But it is something that you should be aware of, that you should wash your hands if you even suspect C. diff, because they usually don't come in with a sign around their neck saying, I've got C. diff, right? They usually come in saying, I just got bad diarrhea, and you're working them up. And then if you're doing the full asepsis protocol, don't use alcohol foam if you're about to do a central line or something like that. You need something more than this, okay? So a few pearls. Make sure that you're focused on your nails, okay? So actually make sure that you get underneath there. You should have your nails trimmed back fairly carefully. If you have overhanging nails, that's a common place that you actually have nodus of infection. Get the back of your hands. It's surprising how often you'll just get your palms and then completely neglect the back of your hands. And then also get your stethoscope. So I think everybody in this room, myself included, should do a better job of actually cleaning their stethoscope. Because I would bet money that almost none of you wash your stethoscope after each patient encounter. It's just really, really hard to remember. But if you combine that for when you're foaming your hands, that you go ahead and get at least a little bit of alcohol foam on the head of your stethoscope, makes a lot of sense, okay? So, a little bit of history. Who's this guy? Huh? I like the guess. You're actually pretty close. And I just got to point out, this is like, so this is not like they just suddenly like snapped a photo of this guy. This is how he chose to be drawn, right? So look at that beautiful hair, those chops. His bow tie's even jacked up. And this is how he like set for a photo to be drawn. This fine gentleman is Ignaz Semmelweis, close to Lister, right? So Lister kind of stood on the back of this guy and got real famous. So he worked in a delivery ward, okay? And you had these two clinics, right? So you can see the mortality rates of the mom delivering the baby were dramatically different between those two, right? Purple line on top of blue line. So the purple line, which was the worst performing line, was actually staffed by doctors and medical students, okay? The second one was staffed by midwives, who honestly didn't have a whole lot of training at all at this time in particular, okay? And then look at these graphs. Despite that, you saw way more people dying. And the patients knew it too. They would actually beg not to be admitted to the doctor ward. They would say, please admit me to that other one. They did alternating days, right? So people would like try not to have a baby and try to make it to the midwife clinic because they know that doctors were killing them. Why? Well, it turns out the doctors were doing autopsies and then immediately delivering babies, right? It's the mid-1800s, different time, right? They didn't even actually understand what germs were, okay? So because of that, they're immediately going from the grossest things possible. So these were non-fixed bodies, right? They're just cutting on dead people to delivering babies. And so you saw mortality rates of nearly 20% compared to the midwives who definitely did not do that gross thing. And then they had much lower rates. So what he did was he introduced the idea of chlorinated lime. So kind of an early antiseptic, right? And mortality fell from nearly 18% to below 2%, right? 90% reduction in mortality because they washed their damn hands, right? It makes sense now, but they didn't even know what bacteria was then. So what happened to this guy, right? Why don't we talk about him, right? Like, he won a Nobel Prize. No, I'm just kidding. He didn't win a Nobel Prize at all. In fact, he was viciously ridiculed by all of his colleagues, had a mental breakdown, was tricked into going to a insane asylum by his friend, was beaten to death by the guards, and died 2 weeks later. That's not a joke. That's really what happened. So in other words, you should wash your hands because this man died for you. So next up, the power of habit. I understand that's only funny to me, but this is absolutely true. Don't laugh at that, man. So next up is a book called Power of Habit. It's really an awesome book. It's actually a little bit more focused on business, but it has a lot of things here that could actually apply. He establishes something called the habit loop. You have a cue that tells you to do something. You have the habit that goes from that, and then you get the reward following that, okay? So if your morning routine is I wake up, then I brush my teeth, and after that I get to have my coffee or something like that, it forms a habit loop that's much more likely to actually cause you to brush your teeth every morning than if you don't have something that cues you to do it and something that rewards you for doing it. So every time you cross a patient door, that should be a cue to use the phone, and then you get to see the patient. And if you say, hey, seeing a patient isn't a privilege, you're jaded, watch out for burnout because it is a privilege to do what we're doing, okay? So you do not start your patient encounter until you're actively washing your hands. If you walk into a room and there was no alcohol foam, say, excuse me, I'll be right back because I can't start doing this without washing my hands. And you should feel deeply uncomfortable if you're ever in that situation where you haven't washed your hands, but you rush into a room, okay? Another important book that I would actually encourage all of you to read is the book Influence by Robert Cialdini. So he describes a click and a whir phenomenon. You have something that triggers you, and then you immediately do something else, okay? And so here, the click would be the door. You cross to a patient's door, you absolutely must use foam right afterwards. And if you establish that, you're much more likely to have a habit that becomes automatic as opposed to this thing that you have to remember to do. So TLC was actually wrong. You do want some scrubs. And I did not time this for when Gross walked in because we've had some back and forth over this. So looking at hand hygiene, we know that we got to wash our hands. But what about the stuff that we're wearing, okay? So how clean are scrubs after a home washing? Anything? Pretty clean? They're very clean. There's actually nothing that they could culture after a single home washing, okay? So the folks that say, hey, we got to lock up all the scrubs and they're going to dispense them through the OR or something like that, they're just wrong. There's no need for a hospital wash at all. As long as you're washing your scrubs yourself with proper technique, you're fine. And when they actually did this at some hospitals, there was no change whatsoever in surgical infections or anything else. And this was for OR patients. Our patients are filthy. Their patients are clean, okay? So remember that you can actually just have a home wash of your scrubs and that's fine. If anyone has ever reworn scrubs to another shift, that's really gross. Do not do that. I want you to treat these as mild biohazards and as soon as possible, change out of your scrubs as soon as you get home, okay? What about white coats? Well, they actually did a study. They took 100 coats and they got 4 swabs each, okay? There was 128 positive cultures from these 100 coats. So those of you keeping score at home must realize some of these coats had more than one positive one. About 2/3 of them were contaminated. This was despite the fact that 71% of the people said that they had washed their coat within the last week. Okay? Dirty, dirty liars, right? Because I know how often I washed my coat when I wore the stupid thing, and it was certainly not once a week. But even if you did, you're still having a bunch of people that had positive cultures. And then most of the bugs that they cultured were resistant to antibiotics, okay? So there's a huge rate of MRSA positivity and some other things as well, okay? So white coats are positively filthy. So you might say, hey, Dan, you lectured a couple weeks ago and said, hey, pose before doze. Well, they actually have tracked down specific bugs that actually could be traced to someone's white coat or ties directly to a patient that got infected. So if you ask me, any patient getting infected over something as archaic as a white coat is too many, okay? And I strongly discourage you using them for that reason. If the British lawyers found out that periwigs, those ridiculous wigs, cause someone to accidentally be sentenced to life for jail, you would say, oh, well, let's get rid of the wigs. And they would. But we can't get rid of our white coats because of, I don't know, historical reasons. It's just very weird. What about you say, oh, well, scrubs seem so unprofessional. Well, when they actually did a study on this, asking patients what they preferred in the emergency department, they actually preferred scrubs to professional attire for those that had a preference. Some of the patients did not have a preference. But those that did have a preference preferred scrubs over professional attire. And then even with the scrubs, they actually preferred the scrubs without a white coat over people wearing a scrubs and a white coat. So white coats are dumb. Just wear some scrubs. You've won the lottery. You get to wear pajamas to work. Why not take advantage of this? So the other thing is neckties, right? So this is another common thing that you see. 17 and 95 ties were actually cultured positive. And they actually did a mannequin study where they actually put some bacteria on a scrub. So they put a marker on a tie and then had you do a simulated session with the mannequin. They had 6 times the transmission of this bug onto the patients when they were doing that with a tie compared to when they're doing that just on someone's scrub top, okay? 6 times the rate. This is completely unacceptable. So ties, really bad idea. When was the last time that you cleaned your stethoscope? Yeah. And that's an uncomfortable question for a lot of folks because they might say, I don't remember, and that's frankly unacceptable. It should preferably be after every patient encounter. I understand that's going to be really hard to remember. So just doing it many times a shift, you'll be way ahead of what other people are doing, okay? So stethoscopes, you can either use a swab or foam. And 1/3 of these stethoscopes had MRSA on a pre-hospital evaluation. They just took a bunch of medics and basically swabbed it. 1/3 of them had MRSA. There's almost no human data. The best trial I saw on this was actually in a veterinary clinic. So it's surprising that people haven't looked into this more as a nidus infection. One study actually had 99 out of 99 stethoscopes culture positive for something. So don't forget that your stethoscopes are positively filthy. Nice. I mean, that is so much better than essentially what people are doing now, which is never. I mean, preferably it's all the time, but if you have that double down, always, always, always under this month, great. Yeah. Yes. So I strongly encourage you to get a clip. It's a lot more comfortable actually, and it will make your stethoscope last longer. What about wedding rings? Are these a major problem? Right? Because we're talking about all these other nidus infections. Are wedding rings a big problem? Probably not, as long as it's smooth. So this was a small study of 10 people that work in the OR. They did a full surgical scrub, mind you. So this is not quite what we're doing. And they cultured the left and right hand to look for wedding ring contamination on the left versus not on the right. The only one that they had positive was someone that had an irregular wedding band. So it was one of those that kind of interwove 2 bands together that are fairly common. So that was the only one that actually had a positive swab on that. The more smooth the surface, the more likely it's going to get clean with just regular stuff, okay? But we actually don't have a lot of data about what would happen if you're not doing a surgical scrub. I would strongly encourage you to minimize jewelry, but a lot of folks have a hard time taking a wedding band on and off, okay? I get it. But watch out for anything that's an irregular surface that's on your hand, okay? So that class ring, probably not an ideal thing to be wearing, okay? Yes. I actually agree with you, but that's what their study was, is basically they did a full surgical scrub while wearing the ring, and then they checked the hands. But it is best practice to have nothing past your elbows. What about ultrasounds? Increasingly, this is our new stethoscope, and much like the stethoscope, it is becoming our new way of infecting patients. So purple for probes, make sure that you grab the purple tops and scrub those down real quick. Yeah, you can use both, but did Lion tell y'all gray? Okay. Okay, ignore that. Listen to Lion. He loves his ultrasound probes. Purple is what most other institutions are using, but gray is fine. Gray is fine. Ignore it. Huh? Gray for gel. Sure, gray for gel. Important thing, though, is you got to get the gel off the probes. I've seen really, really gross-looking ones where they didn't properly wipe off all the gel and then they just wiped it down, which basically means that you have an antiseptic layer on top of an entire pile of grossness. So you have to wipe away all that gel before you get there. Another thing that you can do is if you're doing anything gross, such as you're looking at an abscess or a skin infection, make sure that you cover it up with something like a Tegaderm or something like that on top of it, okay? Because that is a very handy way of keeping that probe even more clean. Phones are really, really gross. So think about this. You're probably lying if you say that you've never used one of your cell phones while on the toilet, okay? These things are gross, but you might just pull that out on shift, right? Increasingly, you're like using that to look up something or something like that. These things are gross. So 95% of the time, in one study, you actually got an infection or infectious agent on your hand if you used it for a 1-minute phone call, okay? It's probably actually worse if you're actually using it to poke your phone for other things. So if you check your phone, wash your hands because your phone is gross and very, very difficult to properly clean. What are some unknowns where we really just don't know? We really don't know much about watches because I really couldn't find any studies about whether watches are a good idea or not. It is another site that can get infected and nobody washes their watch, okay? So I've actually, while researching this, I've stopped wearing a watch on shift. It is a little bit annoying because it's hard to know exactly what time it is, but watches are another source of infection. Rings other than wedding rings, we have almost no data for, but the more irregular the surface, the more likely it is to pass something on. Tie tacks have not properly been studied. So a lot of the problems with the tie is that when you lean over, it will lean down and touch your patient. And so unless you're taking a long time to get the patient really high, when you listen to them with a stethoscope, it's almost certainly going to be the case that your tie touches them. We frankly do not know if a tie tack basically takes away the infectious risk of ties. We don't know. So to use maximal caution, watch out for anything long sleeve, okay? Anything past the elbow is a risk. No ties, or if you have to wear a tie for some reason, use a tie tack, and then minimize the amount of jewelry that you're wearing, okay? So what about procedures? Let's run through a few of these. So you've got what I call the dirty procedures, right? The patient wasn't sterile to begin with. So this would be things like abscesses or lacerations. These are very different than if you get cut in the OR, where you had a sterile knife through sterile skin that has sterile human body underneath it, compared to I cut myself in the kitchen with a knife. None of that is sterile. And what that means is that you can use tap water to irrigate it and just regular nitrile gloves to take care of them. If you prefer latex gloves because that's easier for you to sew and you like the way that it feels on your hand, that's fine. Just know that this was never a sterile procedure to begin with. It's a clean procedure, okay? So if you use tap water, you're more likely to use the proper amount to actually irrigate that wound, and that's actually a superior thing to do. What about what I call the clean procedures? So these are generally things where you're going into a sterile space. So things like Foley's, lumbar punctures, arterial lines, and joint taps. These are things that you should be considering these things. The drapes and sterile gloves would be mandatory for all these things. The hat and mask historically has not been done for things like putting in a Foley catheter or something like that, but it's almost never really a bad idea. For things like arterial lines and joint taps, increasingly they're escalating the amount of sterile procedure you have to do, where a few years ago it was pretty common just throw on some drapes, use some sterile gloves, and you're good. But now increasingly they're wanting us to do things like even full sterile prep for some of those procedures. So what about that? With arterial lines, let's say that you say you got to do the full show, the same thing that you do for the central lines. What would happen to your infections from arterial lines? Any guesses? Okay, you're right. So it doesn't actually help. There was only one randomized controlled trial, which interestingly actually had a higher rate of infection when people went to maximum barrier, which might signal that people were actually a little bit sloppier with exactly what they're doing because of all the draping and the gowning and all that. They were getting sloppy as opposed to just doing it what they should be doing, okay? So the one trial was negative. That being said, you will see some hospitals that say every arterial line has to be under full drape. That's an administrative thing, not a scientific thing. What about full sterile? The only procedure that I can think of that we routinely do that require like the full sterile show are central lines, okay? There are other things that in a perfect world you would be doing for full sterile, such as a crash C-section or a thoracotomy or something like that. And I encourage you as much as possible to try to get that. If you know that it's going to be happening in 60 seconds, try to get as much of a scrub in and throw on some sterile gowns and all that as you can. But to be honest, those things are so quickly that you are not going to get to the full sterile prep. So with central lines, you want the full drape, you want the full scrub. I know we're doing a lot of training on this, so I'm not going to belabor this point. But I couldn't think of anything else that we're doing that requires the full draping from a scientific standpoint. If you're doing a central line, you want to use betadine or chlorhexidine? Yes, thank you for actually. So chlorhexidine, absolutely. So surgical site infections were reduced with chlorhexidine versus betadine, and this is in many ways a surgical type procedure. And it's part of our bundle, and then a Cochrane review supports the use of it, where they actually saw a drop in infection rates when they were looking at chlorhexidine versus betadine. Is the full bundle necessary for a central line, or can you just do part of the bundle? Come on, guys, I know it's early in the morning. Do the whole thing, right? Yeah, so we kind of drill this into you. You really can't do part of a bundle. The nurses will not certify it if you got like 3/4 of the way there and then fumbled the football right before going to the touchdown. You have triple the infection rate if you did part of the bundle but not all of the bundle in one study. So you can see that any small break in this, it doesn't matter how much of a dog and pony show you did with, oh, look at how long I washed my hands for 5 minutes. If you're not properly cleaning the skin, or if you're not properly using the ultrasound probe with a sterile cover over it, it doesn't matter. Okay, you could scrub your hands for an hour. Doesn't matter if you had a break in the other part of the procedure. So you really got to do the whole thing in order to actually get any benefit out of it. Can you use chlorhexidine before a lumbar puncture? No. What? Why not? Well, it wasn't FDA approved for it. And why wasn't it? Because that sounds expensive. So they didn't actually do an FDA approval for it. There was basically some bench studies that said maybe this isn't bad, or maybe this isn't a good idea to have near the nervous system. Someone did 12,465 procedures using chlorhexidine and had a complication rate of 0.04%, which is exactly the same rate as when they use betadine. So in the not young population, it is safe to use chlorhexidine. A lot of people still use betadine because that's what it says on the package. Just know where that comes from. It's not science. It's just they didn't get it FDA approved. There is almost no data for the little kids. Okay, so I will strongly encourage for pediatric LPs that you continue to use betadine, because we actually don't know if chlorhexidine is actually okay for neonates in general. It likely is sort of kind of okay, but there's so little data that I strongly encourage you just to use betadine when you would have used chlorhexidine in the kids, and make sure it dries as well. What about ultrasound? Yeah. Yes, that's where it came from, was the chemical meningitis risk. It just looks like it's not borne out in actual populations because you're just puncturing in and getting out. I would not want to instill it into the meninges. What about what prep should you do before doing ultrasound guide IV? Yeah, so you should do chlorhexidine, put a Tegaderm over that probe, okay, because it's really important to actually keep it clean. And then use the packets of gel. Don't use the bottle of gel. That's not sterile at all. So use some of the little packets of KY jelly or something like that, okay, commonly forgotten about. Are there any studies of infection for full gown and traumas? So whether you have to wear the full gown versus just wearing gloves and a mask? Maybe? No, there's no studies at all. We have no idea whatsoever. The reason that you're wearing that equipment is to protect you, not to protect the patient. Your trauma patient is dirty, okay? Unless they were involved in a shooting with a sterile gun in the operating room, they are not a sterile patient. And if they were, that's awesome. Like, I really want to take care of that patient with a sterile bullet and a sterile gun. Oh man, that'd be great. But there's no studies on this at all. So you're protecting yourself. So if they're bleeding everywhere, they're really the only place on a body, like if you just did the full carry situation and drenched me in blood, about the only place that I'm actually going to have a real risk of getting infection is my eyes, okay? So gloves are essential, and I really want you to consider a face mask with a shield for as many of these trauma patients as possible. I know that we are moving towards you have to wear the full gown and all that for every single trauma patient. I personally think that's overkill, but it does follow ATLS, which basically cites the CDC saying that you should be fully gowned every time. I think that that's an overkill situation because most of your patients aren't bleeding that much. And if you do get blood on your scrubs, you wash your scrubs. It's not that big of a deal, comparatively speaking, okay? So just make sure that your essential bits are covered. Does anyone have any questions? That's true. And especially if you're doing an airway, so this is one of those things people forget about. If you're intubating, you really ought to consider wearing a face mask, because there's a whole lot of times where someone has that like last loogie before the paralytic kicks in. It's pretty gross. So I would strongly encourage you to get used to wearing a face shield for all your intubations. So take home points. All right, so take home points, foam every time. Click, wear, foam, right? Wear scrubs with almost nothing past your elbows whenever possible. Clean your stethoscope as often as you can, and watch out for that ultrasound probe. It's surprisingly dirty. Your cell phone is absolutely filthy, and that's not just the content on it. That's actually what you're touching. And chlorhexidine is better than betadine for essentially everything. I'm out. Thanks.